Hi, this is an information session regarding multiple sclerosis and the services available for these patients in the ACT. Presenting today will be the physiotherapy students Molly, Suzanne, and Sam, OT students Lisa, Emily, and Jess. Our client is a 25-year-old male who has recently relocated to Canberra to begin studying Master of Pharmacy. He is newly diagnosed with multiple sclerosis after a history of blurred vision and tingling in his arm. He is still awaiting review by ACT Health Services and has received minimal information about his condition and appropriate services in ACT so far.
Multiple sclerosis is an autoimmune disease that involves demyelination of the central nervous system. It encompasses a broad range of neurological impairments, most commonly loss of strength and dexterity, which can lead to severe disability. Multiple sclerosis impacts quality of life more than longevity and has potential genetic and environmental influences. There are 4 different types of MS, the most common being relapsing-remitting, where patients have several episodes of relapse and recovery. Recovery may be partial or complete. Like all chronic diseases, it represents a lifelong burden for patients and creates uncertainty for both patients and their families.
Being diagnosed with multiple sclerosis can be overwhelming, and finding the support you need can lead to confusion and stress. As the peak advocacy body representing those living with multiple sclerosis, MS Australia provides a gateway to all the support you need to manage your health so that you can do all the things you need to do, want to do, and are expected to do in your everyday life. For example, MS Australia can provide up-to-date evidence-based information about multiple sclerosis, what it is, the different types, and how it might affect your health and well-being, as well as your ability to participate in your usual occupations. They provide information about what you can do to manage your symptoms, such as keeping fit and healthy, managing your fatigue and stress, and getting adequate nutrition. MS Australia can help you understand financial benefits you might be entitled to from both federal and state levels, such as payments for people with disability and available support from the National Disability Insurance Scheme. Furthermore, MS Australia provides advocacy services and help to understand what constitutes disability discrimination, the laws in place to protect you from it, and support to fight discrimination if it happens to you. MS Australia provides information on employers' responsibility in the workplace, as well as advice on adjustments they can make to help you do your job. Another function of MS Australia is to provide evidence-based information on treatment options for multiple sclerosis. State-based branches of MS Australia can provide links to local health professionals and services that deliver those treatments. They can also provide referrals to those services. The ACT branch of MS Australia is located at 177 Denison Street, Deakin. MS Connect is a phone service that operates from 8:30 a.m. to 5 p.m. Monday to Friday. People with MS can call to receive information and support in a range of areas. In particular, the phone service can provide advice and help connect you with local allied health professionals, social services, and education programs. They can also link you up with other people in your area who are living with multiple sclerosis for support and understanding. Additionally, the phone service can provide advice and support to family and carers, including respite options, to give families short-term breaks.
The MS Australia website is a great resource for people living with MS. There is information about how to manage your symptoms, improve your health and wellness, education on MS, as well as help and support. There is even a section specifically for people who are newly diagnosed. The site also has information for families and carers, a search engine to find local services, and a peer support service that can connect you to others in your area who are also living with MS. Education sessions and webinars cover a wide range of topics related to MS and are held regularly. Subjects include symptom control, mental health, and new research. Contact MS Connect or check their website for times and dates. Newsletters keep people up to date with recent events and information in their area, which are available from the MS Society in Deakin. There are many social MS groups in the ACT region. They meet regularly and provide patients with a social support network with similarly affected people. The first one is the Canberra Cafe Group, which is held in various cafes around Canberra every Friday morning. Then there is Taking Control of MS, which is held in Deakin on every second Saturday of the month from 2 p.m. to 4 p.m. Another group is People with MS Support Group, also in Deakin, which is held on the last Friday of every month from 12:30 till 2 p.m. There is also a 6-week teleconference peer support program coming up in March, April and May. It connects people newly diagnosed with MS to each other to provide them with a support network.
As the client's disease progresses, he will experience relapses and his mobility and function will decline. During these stages, he will need access to a range of health providers to ensure he is able to regain function and independence. The Canberra Hospital has a fantastic neurology department and is most likely to be the place where he is admitted if he does have a severe decline in function or health during a relapse. After his stay in hospital, he'll most likely be referred onto the community health team. They have a range of physios, occupational therapists, psychologists and social workers who are able to assist the client in returning to independence and normal life. It is a short-term rehab program, but the client has the ability to re-refer after future relapses. The student-led clinic at University of Canberra provides both physio and exercise physiology services to people with a range of neurological conditions. The client will have an initial assessment with physios and exercise physiologists if required, and then can attend bi-weekly classes at the clinic run especially for people with MS. This is an ongoing service that the client can access for years to come. The physio assessment at the clinic may include strength, specific multiple sclerosis measures such as the fatigue severity scale, the MS self-efficacy scale, and the MS functional composite, all of which are important when setting realistic goals and developing individualized programs. A gym membership would also be beneficial for the client. An individual program designed to maintain his fitness and strength as well as his function would prevent unnecessary deconditioning. The Be Better Balance program is run with the student-led clinic and the Belconnen Health Centre. It includes an initial physiotherapy assessment at the student-led clinic and an ongoing balance classes held at the health centre. There are also specific MS health services in the ACT, such as the MS massage and Drew Yoga, with the contact numbers provided on the screen.
It is important to link the patient to exercise groups, as evidence has shown that people with multiple sclerosis are more sedentary than their capability suggests. Patients often become deconditioned, which further contributes to fatigue. Aerobic exercises have been found to be advantageous in those affected by multiple sclerosis, as it reduces fatigue, improves quality of life, and increases strength and fitness. Therefore, linking multiple sclerosis patients to these exercise groups is vital in providing the best care.
So in the future, treatment will include working with the Independent Living Centre at Western Creek, and this is for our equipment supplies, and these can be organised through his MS liaison, his occupational therapist, his physiotherapist, or one of his allied health team supporters. Also, he'll need to access vocational assistance, driving assessment and assistance, particularly if he's wanting to modify a vehicle. He'll also want to access home visits from a community health team, and again, these will include your physiotherapist, occupational therapist, and allied health team. So in conclusion, overall, at this point in time, our client needs to be linked to the support services and the MS Society. This is so that he can get information as he needs, and as his symptoms progress, he's also got access to ongoing information. While he may not need any of these services currently, it's important that he understands that where he can find help, he feels confident in his self-management. By following best practice and evidence currently surrounding MS, it's going to be advised that he is encouraged to exercise, that he links in with MS exercise groups to maintain his quality of life, his strength, his fitness, and manages his fatigue into the future. Thank you for listening, and all references can be found on slide 13. Thank you.